Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Today we'll continue our presentation in history taking. Our presentation today about palpitation. Palpitation is perceived abnormality of heartbeat characterized by awareness of cardiac muscle contractions, either hard, fast, or irregular beating of the heart. Supraventricular tachycardia, a rapid heart rate originating above the ventricle and can cause heart to beat very quickly or erratically. Ventricular tachycardia, rapid heartbeat originating from the ventricle, if associated with structural heart disease, might cause loss of consciousness, cardiac arrest, or sudden death. Many causes for palpitation: first, arrhythmia like atrial fibrillation, ectopic beats, premature atrial contraction or premature ventricular contractions, heart blocks, ventricular tachycardia, multifocal atrial tachycardia. Physiological causes like stress, exercise, or fear. Cardiac causes like mitral valve disease, mitral valve prolapse, aortic regurg, atrial myxoma, ischemic heart disease, hypertrophic cardiomyopathy, atrial septal defect, pacemaker-mediated tachycardia, and pericarditis. Psychiatric causes like panic attack, phobias, and depression. Drugs like salbutamol, anticholinergics, thiophyllin, pseudoephedrine, diet pills, and beta blocker withdrawal. Habits like caffeine, nicotine, alcohol, amphetamines, and cocaine. Electrolyte imbalance of magnesium, potassium, and calcium. Hormonal changes with menstruation or pregnancy or menopause. Non-cardiac causes like hyperthyroidism, hypoglycemia, pheochromocytoma, fever, sepsis, hypovolemia, anemia, and pulmonary disease. Differential diagnosis for palpitation: benign ectopy, it will be felt as single skip beats, worse at night. Supraventricular arrhythmia will be abrupt onset, rapid regular bounding in the neck terminated by vagal maneuvers. Coronary heart disease, palpitations will be associated with activity. Hyperthyroidism will be felt or complaining of heat intolerance, tremors, anxiety, and diarrhea, and weight loss. Atrial fibrillation, onset over seconds, rapid and irregular rhythm, and pheochromocytoma, abrupt episode of anxiety, fear, chest tightness, sweating, headaches, and marked rise in blood pressure. To start station with palpitation or history for palpitation, start with the set or opening the encounter. The same questions, greeting and introduce yourself. Hi, I am Dr. Hadidi, SHO of Internal Medicine. Confirm patient's details. So you are Mr. Muhammad and you are 78 years old. Build a good rapport. Please have a seat. May I sit beside you? Explain note taking. If you don't mind, I would like to take some notes for the purpose of interview, which will be strictly confidential. Agree the agenda. I have received a letter from your GP stating that you have heart racing. Is it right? For the dialogue, present history is a presenting complaint. Can you tell me more about your feeling of heart racing? Do you have any heart racing or irregular heartbeats now? What were you doing when you felt the heart racing for the first time? If during exercise or extreme fears, think in ventricular tachycardia. After exercise, think in supraventricular tachycardia and AF. On standing, think in AV nodal reentry tachycardia, which is part of supraventricular tachycardia. How long have you been experiencing heart racing? How long does each episode of heart racing last on average? And can you describe the worst episode of heart racing you have had so far? Second, we'll go to history of presenting complaint for a numeric Odabara. O is the onset. How did it start? Did it start suddenly? What were you doing at that time? Does it occur at a particular time? D, duration. When did the heart racing start? How frequently you feel this heart racing? How often do you experience heart racing? And B, for progression. How was it ended or how was it terminated? Is it terminated, or was it terminated sudden or gradual, or with maneuvers like holding your breath or massaging your neck? Aggravating factors, do you know what could be caused it? Is it alcohol, caffeine, exercise? Does it occur on exertion? For progressive factors, anything makes it better. What makes it better? Can you terminate it by deep breathing or holding your breath? A at the end is associated symptoms. Have you had any syncope, pre-syncope, chest pain, or shortness of breath, which are the red flags for ventricular tachycardia or very rapid SVT? Did you faint or lose your consciousness during the attack? Do you have any shortness of breath? Did you feel any chest pain? Did you become sweaty during the attack? Have you noticed passing more water than you used to, which is polyuria might be associated with supraventricular tachycardia? Have you noticed any shaking hands, sweating, weight loss, like in hyperthyroidism? Specific questions for palpitations. Did you take your own pulse at the time of heart racing? Was your heart beating fast or slow? How fast was the pulse rate? Was it regular or irregular? Can you tap out your rhythm of the perceived heartbeats? Any sensation of skipped beats, extra beats, or flip-flopping? Second, for past history, ask about similar attacks. Have you had similar heart racing attacks before? Did you see a doctor for heart problem before? What did he tell you? Did you do any scans or blood tests? Has it ever been recorded on an ECG? Do you know what was the results? Do you have any heart disease like rheumatic heart, congenital heart disease, coronary artery disease, congenital or valvular heart disease? Have you ever had heart attack, which might indicate ventricular tachycardia? Have you ever been admitted to a hospital for heart problem? Do you have any gland disease asking for thyroid? Have you ever had bronchial asthma? Have you ever had blood clot in your brain? Ask for stroke and TIA. Have you ever had heart surgery or had a pacemaker inserted? Have you ever had any psychiatric problems like anxiety, depression, or panic attacks? For medications and allergy, ask, are you currently taking any medications? What medications are you taking? Any over-the-counter, any herbal remedies? Ask specifically about tricyclic antidepressant. Ask about thiophyllin, beta agonist, over-the-counter cold medication or diet pills, beta blockers, amiodarone, digoxins, which are arrhythmia medications, and anticoagulants. Do you have any sort of allergies? In family history, don't forget to ask about any similar condition in your family. Do you have any family history of sudden cardiac death? Did anyone in your family suddenly die with no clear cause, like prolonged QT interval syndromes, Brugada, and Wolff-Parkinson-White syndrome? In social history, ask about physical fitness. Has your physical fitness affected by your illness? Can you get to the grocery store or pharmacy in your own? Ask about alcohol intake. Do you drink alcohol, and how often do you have a drink? What do you drink, and what type of alcohol do you drink? How much do you drink per day or per week? When was your last drink? If less than 24 hours, this might be a problem. Also ask about driving. Do you drive, especially if palpitation caused syncope or collapse? Occupation, what do you do for living? Is it stressful life or no? Have you had any stressful events in your work or at home? For tobacco, do you smoke, and how much and for how long? For recreational or illicit drug use like cocaine or amphetamines, do you use any drugs that alleviate the mood? What exactly do you use and how do you use it? Ask also about ideas, concerns, and expectations. What do you think might be causing this problem? And are you worried about this being anything in particular? And what do you think might be the best plan of action? At the end, for closure, summarize the main points. May I take a moment to summarize what you have told me so I can check that I have understood everything that's important to you? Ask about any outstanding issues. Is there anything else we haven't discussed that you feel is important? Create a list of problems. So I think you have a problem in your heart called atrial fibrillation, in which the heartbeats are not originated from the normal part of the heart. Instead, it's irregularly coming out of different parts of the heart. Then plan the next few steps. I will examine you first. We may need to do some tests in the form of blood test and electrocardiogram for your heart. This can be done on outpatient basis. Then I will decide whether to admit you or not. Then counsel on any on health promotion. Like there is an advice I need to tell you about. Smoking is not good for your health, and I am going to arrange another meeting to help you to quit if you wish. Check understanding. Is there anything unclear you need me to clarify? At the end, thank the patient by name. Thank you, Mr. Muhammad. Thank you so much. And these are next few presentations in our courses, free medical courses.